So what made us think that dogs might be able to smell cancer? Well, the story started many years ago when the first anecdotal stories started to appear around the world, people reporting that they believed their pet dogs could smell cancer. Now, the story started for me when a friend of mine had this experience and her dog warned of a malignant melanoma on her calf. These stories were reported in the medical journal The Lancet on 2 occasions, and it got us thinking, could we actually train dogs to identify the odour of cancer? This we did in collaboration with the Bucks NHS Trust, and our paper was published in September 2004 in the British Medical Journal. It was the first robust proof of principle study showing that dogs could indeed be trained to smell and identify the odour of cancer reliably. After we learnt that dogs could indeed be trained to recognise the smell of human cancer, there was huge amounts of interest from all over the world, and this has led to a large number of research projects. In the UK, we continued this work, and in 2008, Medical Detection Dogs, the charity, started, and our work has continued from there. We particularly investigate ways in which dogs can assist in human health by learning to recognise a whole range of different human cancers. A cancer alert dog is not trained to go and identify cancer on the actual person themselves. So a cancer alert dog does not go and sit beside someone who has cancer. What these dogs are trained to do is to recognise the odour signature. This is the volatile pattern or the smell that cancer cells give off in samples. So the dogs are trained to recognise and screen samples of either breath or urine, but they would never work by going up to a patient and sitting beside that patient. Our dogs are helping with this important cancer research, but the charity has a complete no kennel policy. So all our dogs live in homes with families and just come to work Monday to Friday and have the weekend off. So there are 2 ways in which the dogs are going to make a huge difference to the way in which cancer is diagnosed in the future. Firstly, if a machine can be designed that mimics the dog's nose, this means that it could change the way cancer is screened in the future. Using a nanosensor that would look for the same volatile pattern that dogs use would mean that there was cheap, non-invasive, reliable ways of diagnosing cancer early and therefore saving thousands of lives. And this isn't science fiction. Since the 2004 study, there have already been 3 electronic nose systems designed, stemming from the work of the dogs, which have indicated that this is a true possibility. In the shorter term, dogs can help by offering second-line screening. So for cancers that are particularly difficult to identify, for example prostate cancer in men, the current test, PSA blood test, has a 75% false positive rate, meaning that 3 in every 4 men who have a raised level in fact have not got cancer. The dogs could offer a service whereby they screen a urine sample from a man with a high PSA and giving an indication with a very low false positive rate of whether or not the man has a possibility of prostate cancer. The 2 tests combined would be much more reliable, give a much higher level of predictability, and therefore could save thousands of lives.